walking up to the scene, I had PSI, scene looks safe, mechanism of injury looks like they fell off the step ladder here. General impression, they look like maybe they're in some pain. I'm gonna go ahead and call 911 just for precaution, and then I'm gonna have a bystander hold C-spine. I wanna make sure that everything's okay there. Hello, miss, my name is Elly. I'm an EMR. Can I help you today? Yes, please. And what is your chief complaint?
My leg hurts.
Your leg hurts? Okay. So the first thing I'm going to do is check your airway. So can I look at your airway? Okay, it looks open and clear. Next thing you want to do is assess your breathing. So I'm going to go right here. Just go ahead and take a breath for me. Looks good. Bilateral expansion of your lungs. It sounds good. So I'm going to expose, make sure everything looks good there. And I'm going to expose. Here, can I expose? And check for any bruising, anything looks abnormal there. And I'm also going to check circulation. So I'm going to feel, make sure I get a radial pulse, and there it is. And then for circulation, I'm also just going to check for any bleeding anywhere. So I'm going to feel all over, check my gloves, and check back here, check my gloves, checking again and again, make sure, checking my back, make sure everything looks good. Check down the arms, check here, check all over, check the back of the legs, keep looking. I would check in the cuffs on the sides of the arms too. Go ahead and take off the socks to check for any bleeding. Can I take your socks off? Mm-hmm. Okay. And so then I check for any bleeding on the feet. Come back up here. Check for any bleeding on the legs. I'm checking the back of the legs. And then check the arms again, and cast is nice. And so then I would move into the physical assessment, since this is a trauma situation. So I would start with the head and go to this side. I would not step over the patient, I would go around the patient. So I'm going to start on the head. I'm going to check here for any deformities of the skull. I'm going to check facial bones, make sure everything looks good. Have you open your mouth again, just check everything in there. I'm going to check for in the CSF in the ears and the nose. And then I'm going to have you take a breath out for me. Just smell if it's fruity, any diabetic coma, anything like that. And then can you just follow my finger with your eyes for me? Looks good. And then I would also feel the C-spine back here just to feel for any injuries or anything like that. I would also check for jugular distension or tracheal deviation in the neck. And then next I would go down here and I would check the clavicles to make sure everything feels good here, and I would check the shoulders. I would also check the sternums, just feel right there to make sure that's intact as well. And then I would check the ribs, also make sure that feels okay. Next, I would go and I would palpate the abdomen. So I'd palpate the 4 quadrants of the abdomen, make sure that feels okay. Then I would go down and check the pelvis. So I'm going to push together. Is there any pain there? Push apart. Is there any pain there? No. Nope. Okay. Have you had any injuries to your genital region, or did you feel like you hurt anything down there? No. No. Okay. Next, I'm going to go down the legs, and I'm going to check for dots, so deformities, open wounds, tenderness, and swelling. Check the patella too. Just make sure that everything feels. Oh, ouch. Okay. We found something here. I'm going to take note of that and keep going and assess for that also. I'll just come down here, check for everything down here. I'm going to check circulation in each foot. So I'll check capillary refill down here. Can you tell me what I'm doing?
Rubbing.
And then can you tell me what I'm doing?
Pinching.
Okay. And then I'm going to come back up here and I'll check for strength in both at the same time when I come back down. So I'm going to do the same thing, come down here, check for dots again on the legs. Does everything feel okay there? Mm-hmm. Okay. Can you tell me what I'm doing?
Rubbing.
Can you tell me what I'm doing?
Pinching.
And then capillary refill looks good. And then can you press down for me? Good. And then press back up. Good. So So then I'm gonna go back up to the arms and again, check for dots, make sure everything feels good. Can you tell me what I'm doing?
Rubbing.
And tell me what I'm doing.
Pinching.
Cool, good. Sensation looks good. And then capillary refill also looks good. I'm gonna come around back over to the other side and check for dots again. Feels like you have a fracture over here. So capillary refill looks good. Can you tell me what I'm doing here?
Rubbing.
And what I'm doing here?
Pinching.
Great. And then I'm gonna grab your hand on this side and can you squeeze as hard as you can for me? Great. Excellent. So everything looks good in the physical assessment. And from here I'm gonna move on to vitals. So I'm just gonna get the baseline set of vitals. So I'm gonna start with level of responsiveness. So do you know your name?
Lexi.
Do you know where you were?
Yes.
Okay. Do you know what time of day it is?
Afternoon.
And do you know what happened?
I fell off my ladder. I was just doing some work.
Great.
Some handiwork.
Great. So she's at A plus O times 4 because she knew all of the answers to the questions. And then I'm going to go ahead and take her heart rate. Since I find it. Okay. Okay, so your pulse was at about 100, so it's a little high. But then your quality was strong and the rate was regular. No, yes, it was 100, about 100 regular strong. That's what I'm saying. And then I would also check breathing at this time. Okay, so your breathing was at 16, so I took them both for 30 seconds and then multiplied by 2. And then for the rest of your vitals, I'm going to go ahead and check your pupils. So on the count of 3, just look up for me. 1, 2, 3. Good, they're both equal, round, and reactive to light. And then I'm also going to check the pedal pulse to check for blood pressure. So go ahead and extend your great toe for me. And found the pedal pulse, so that means that blood pressure is at about 90. And then I would move on from there to, oh, I need to check the skin, forget about that. So I would check her skin. Her skin looks warm and dry and pink, all the things. So then I would move on to sample from there to the medical part of the assessment. So what are your symptoms?
I just hurt my leg, bump on my leg.
Okay. And so then I'd move on to the OPQRST. So when did this start? Like, what was the onset?
When I fell off the ladder.
Okay. And was it like slow or gradual or?
It got a little bit more painful as I was laying here.
Okay. Okay. And so is there? So P is for palliates. Does it like? Is there anything that like, or like provokes or palliates? Like, is there anything that like makes it worse or anything like that?
Just keeping it straight right now. Just,
Okay.
Letting it rest.
Okay. Okay. So Q is for quality. Is it like a sharp pain or a dull pain?
It's kind of just like an aching pain.
Aching pain. Okay. And then does it? radiate anywhere?
No, just kind of like around. It's pretty localized.
Okay. And severity, so like on a scale of 1 to 10?
Like a 4.
Like a 4? Okay. And then time, it just happened when you fell off?
Mm-hmm.
Okay. And so then we'll go back to sample. So A, do you have any allergies to anything? Any medications, any foods, anything like that? No? Okay. For M, so are you on any medications? Are you using anything prescription, recreational, over the counter, any of that kind of stuff? No? Okay. P is for past or pertinent medical history. Do you have anything else recent that's happened?
I run a lot, so I get some shin splints. That hurts from time to time.
Okay.
Yeah.
Okay. And when did you eat last?
Like 2 hours ago.
Okay, and when did you use the restroom last?
Like 20 minutes ago.
And did you do number 1, number 2, both?
Mhm.
Yes, okay. And E, do you know the events leading up to your,
I just fell off my ladder.
you fell off your ladder, okay. And so then, from then, I would probably take vitals again, and then I would treat for shock if there's any indication, and I would reassess the leg injury, treat however necessary, and then I would make sure that EMS is